our audience who made it through the rain, because as we know, rain goes a long way in Houston, Texas, doesn't it? It is Medical Monday. A segment you might see today could be the answer to a nagging health problem you have or someone you know has. We're starting off with hot topics. The cover of the magazine, Time magazine, says a radical new drug for Alzheimer's disease could be on the horizon. Could this be the key to help prevent the number of seniors who die with the disease, 1 in 3? Let's ask the experts on our panel. Please welcome gynecological surgeon Dr. Giannotti, OBGYN and expert in wellness and aesthetics, Dr. Shelena Lalji, also known as Dr. Shel, ear, nose, and throat specialist, Dr. Michael Kaplan, periodontist, Dr. Raouf Hanna, and chiropractor, Dr. DeRamus. Good morning, everybody. So research going on all the they love you. But research going on all the time, you know, from different angles. One is prevention, and the other is, of course, treating or getting rid of something. But Dr. Frank Longo is testing a medication for Alzheimer's, and it kind of attacks it in different ways. Previous drugs right now are being tested in mice, but the old approach was to modify what went wrong in Alzheimer's in that brain. The new approach is topping off the levels of nerve growth factors, things that you understand because you went to medical school. But so kind of exciting news here.
Yes. And I think it's the entire thing that we're all going through in the medical field, right? Are we going to treat what's already happened, or are we going to prevent it in the first place? So Alzheimer's it came about and diagnosed in 1906, but since 2000, they have tested over 200 drugs. And this is a very exciting one because it actually focuses on making the brain healthier, to try to fight off those. So this really brings us back to, let's try to get healthier to begin with. Let's try to prevent all that inflammation that occurs in the body as well as the brain, so that we can make the brain more powerful and be able to fight off the things that cause Alzheimer's to begin with, like antioxidants.
You know, with all our doctors, it's interesting. Prevention seems to be the hardest thing to get people to do, because we wait for something to happen, and then we show up and go, okay, hey, well, can you fix this, please? All right, this next one says a saliva test can identify tracking cancers. A liquid biopsy is what they're calling it. It detects tumor DNA in bodily fluids. And of course, if you can do something that quickly and test something that quickly, it does all kinds of things. It cuts down on cost, obviously. You're not cutting somebody open and taking biopsies and stuff. But soon to be in trials with patients. Exciting news?
Yes.
Extremely exciting. Cancer of the head and neck can be very difficult to treat. And in some instances, the cancers can't be diagnosed until it's end stage, meaning it's too far along down the road to really cure. At this point, with this example, you can identify and diagnose this condition much earlier with potentially much more effective curative treatments.
Yeah. And I think more people might be willing to even go have the test because it's just so easy.
Much more convenient as well. Salivary diagnostics are something we've been seeing up and coming in our practice for 10 years now, at least, through cortisol testing, hormone testing, everything else. And so the fact that we have something for cancer is definitely rewarding.
Yeah. All right. New images of a sneeze help explain how germs spread. I can never get out of my mind. Do you remember that movie Outbreak years ago? Yeah, and you see that guy who's infected, you know, with Ebola, and he's at the movie theater and he sneezes. Take a look. And it is the sneeze that travels around the world, right? Okay. After that movie, I remember sitting on a plane and a guy sneezed, and I was like, I'm going to die. I'm going to die. But there is a lot of power in that sneeze, and that is how a lot of, even though we wash our hands and all that stuff, that's a lot of times how certain germs spread.
Yes, and most of this, what we're really referring to are viral infections that can spread through respiratory pathways, and the most common example would be the recirculated air on an airplane, especially, you know, during this time of year. But a sneeze is very powerful.
It is, and you know, the key is, again, we're exposed to this whether we like it or not. So get yourself stronger, build up your immune system. I have a lot of patients who will come in, especially for an IV nutritional cocktail or glutathione, to get their immune system built up so that they don't get exposed to all these germs when they're traveling on the plane.
Yeah, because the mouth can have a lot of things in it, can't it, Dr. Hanna?
Oh, yeah.
Millions and millions of bacteria.
Yeah. And so, in fact, do you look at like gum disease and stuff, it's lots of bacteria, but the body is made to fight certain things off, but you got to help it.
Yeah, well, the bacteria in the mouth actually can travel and you know, we've had some research to show that it was found in plaques around the heart. Brain strokes have the same bacteria that some can found in periodontal disease. So the whole body is connected. Yes.
Yeah. Okay. I always want to ask this question though: would you rather be bitten by a dog or a human?
I would probably take the dog.
The dog's mouth is cleaner. Okay. All right. This research right here, this comes up again and again and again. Either it's between wine or coffee. And it says drinking 2 additional cups of coffee a day reduce liver damage caused by overindulging in food and alcohol. So sometimes, yes, you know, like New Year's Day, and people wake up and go, I need a cup of coffee. And the idea behind that is that you just have certain things in coffee that help clean the liver.
And once again, Deborah, it's all about the antioxidants. So we do know that coffee has antioxidants, but it also has a very complex chemical compound of many different chemical things that we don't know which one is actually helping in this research. We know the liver is a very vital organ. We all need it for many reasons, but we also know that we have access to many different nutrients and antioxidants that can directly help the liver.
Yeah.
Thus, not really reaching for 5 cups of coffee a day just to help the liver.
Yeah, the problem is we're going to come out with another study right behind it that says drinking coffee can kill you. I mean, I know don't call me, but we know that. The studies go back and forth. They're like, what do I do? Okay, so I'm going to keep drinking my coffee. Yeah. All right. Up next, can you eat your back pain away? Eating lots of inflammatory foods can cause muscles to contract without relaxing. We've heard a lot about the idea of inflammation, you know, over the last several years, and things that can cause inflammation include the food that we eat. So when people have certain aches and pains, sometimes it's not that they really pulled something, it's the pressure from the inflammation.
Yeah, chiropractors for a very long time have been saying that the 3 major stresses of physical, emotional, and chemical can have a huge impact on the body. And so now we're seeing a lot of research go back toward the inflammatory effects. We mentioned certain neurodegenerative problems that occur because of that. Yeah, all these have an inflammatory reaction. Once that takes place in the body, you can start to damage tissue, damage the spine, certainly.
Okay. All right. How well does testosterone gel work? First, we've got to understand what testosterone is. And a lot of people don't realize that women have testosterone also.
Correct. Right.
And what role does it play in the body?
You know, just like any other balancing hormone, I mean, men also have a certain amount of estrogen that's there. It just plays different roles, in either sex. The theory with women is that it may impact libido, energy levels, and things like that. Unfortunately, there's been a big push by a lot of pharmaceutical companies, men's magazines, women's magazines to really push testosterone, and we're finding that sometimes the side effects are actually worse than the benefits.
Yeah, but only because I think there's a difference between balancing your hormones and then taking extra stuff, right?
So it's all about customization. You really have to start with looking at the patient's symptoms first and foremost. But you also have to back that up with testing. Yeah. So we do a lot of saliva testing in our office as well as blood testing. But you want to, if you're looking at a man, you want to look at their total and free testosterone as well as many other things to see if they really need it.
Right.
So the range is very wide. It's from 300 to 1100 for a man. Now, are they at 900 or are they at 320? Either way, you could say that they're within the range, but they're going to feel totally different. So we want the men and women that we see to be optimized,
right?
Not overcorrected by any means.
Because we have testosterone naturally in our body, so it's not a bad thing. It's just bad if you're overdoing something.
Absolutely. So make sure that it's balanced, make sure it's customized, and don't overdo anything.
Because it's also going to be a bad thing if you have less than you need.
Yes.
So,
yes.
All right. Well, that's it for Hot Topics right now. But at recent anti-aging health conferences around the world, medical professionals have come to the conclusion that human beings are about to extend their lifespan. Between preventive measures and more life-saving breakthroughs, if you're around 50 years old today, some scientists say there's no reason why you can't live to 120. And that's a quality life. Oh, they're excited. Yeah, you're excited because you'll get to meet your great-great-great-great-great-great-grandchildren. So today on Facebook, we want to know, how long is too long? At what age would you want to say, see you in the afterlife? Or does it just all depend on how you feel? Also, think about what that would do to the population, the job market, traffic. Okay, watch out. Here comes Deborah driving her station wagon at 119 years old. Well, let us know your thoughts, and we'll share them later on in the show. When we come back, you need the hysterectomy or